There we go. Next slide.
Okay, very good. All right, so many of you are already familiar with Zoom, but we are in a webinar today, so that means that all of your cameras and audio are turned off. We do encourage participation in the chat and the Q&A box. And if you have any special access needs, please message the hosts and panelists and we'll make sure that you get what you need. All right, so we will release a recording of this session next week as well. Next slide. This forum is a collaboration between 11 different National Training and Technical Assistance Partners, or NTAPs. NTAPs are funded to provide free training and technical assistance and support to health centers in a manner that increases patient safety and health outcomes to effectively serve health center populations. This training and technical assistance often takes the form of learning collaboratives, state, regional, national trainings, webinars, newsletters, toolkits, and fact sheets. We gathered together to address extreme heat because we're hearing and seeing the shared challenges across various special and vulnerable populations served by our partner health centers and lookalikes. To learn more about the NTAPs and the individual priority populations they serve, please visit the link in the chat. Next slide. All right. My name is Renee Edwards. I'm the Director of Training and Technical Assistance at Migrant Clinicians Network, and I'll pass off to my colleague Becca to introduce herself. Becca?
Sure. So hi, everyone. I'm Becca Young, and I'm the Director of Programs at Farmworker Justice.
Next slide. All right, for today's session, we will hear from two wonderful panelists. First, in the form of a presentation from Dr. Cheryl Holder from Florida Clinicians for Climate Action, and then a facilitated discussion with Amy Liebman from Migrant Clinicians Network. We'll then highlight some additional resources before concluding. Next slide. And without further delay, I'd like to formally introduce our first guest today. Dr. Cheryl Holder.
Can you hear us? Can you hear me, Cheryl? All right. I'm trying to share the screen for you, allow you to give you access, but I lost the option now. Kara, can you guide me again? I didn't see. You said it was more. I saw it before.
Be more and then remote control.
Where's the more at though? Is it down below?
It should be on the sharing screen bar, and then it should be 3 dots.
I don't see it now. I saw it earlier, but I don't see it now. All right. Sharing screen. Well, Cheryl, just let me. I can share them for you. Just say next. I'll keep up with you. Don't worry. All right.
I'll do that. Well, thank you. I can start now?
Yep.
Thank you, everyone, for inviting me. I've been with internal medicine for 40 years, but I've worked with several federally qualified health centers over my time. I'm most recently at CHI in South Dade and Center for Child and Family Enrichment in Miami Gardens. But I've done Liberty City and very well aware of this group and very proud of the work that the FQACs have done through the nation. You can keep going. Next. I always start with anime. And this is a patient who back in 2016 kind of gave me my aha moment and helped me to realize that I had to unlearn some things. And some of those things I had to unlearn was the role of heat and climate change in my patients' lives and how this thing that we talked about that seemed like polar bears is really happening now. Multiple medical problems, but she couldn't pay her light bill. Next. And we know this by seeing how much CO2 we've put up. Climate change happened because of global warming. Global warming happened because we put so much pollution up in our atmosphere. Next. And most of this happened over the last 250 years with us becoming as modern and living the lives that we now live. So putting all the CO2 basically created gases in the atmosphere. And in this exchange, think of heat being generated when movement happens. So think of your atmosphere as moving, vibrating, and that's what's creating the heat. And it's creating like a warm blanket and trapping the heat in our planet, which then leads to all the changes that we're seeing now. Next. And with the heat, we know it's getting worse, especially at night. Next. And it's creating again, the warming of the planet led to the massive changes in our climate, which then leads to all the health impacts directly, indirectly. And I don't have as much time. You'll be able to get this presentation, look at it to see all the ways that we're affected. But I really want to focus on extreme heat this time. Next. And when we're dealing with heat, your body has got to maintain the average temperature. And so you're going to produce heat by yourselves internally by what we do when we work, when our bodies use food and just survive. And then we have to figure out ways to lose it. And it is in that regulation that we have to maintain good temperature. Next. Next. I recommend this book for everybody who wants to understand heat. Jeff Goodell's The Heat Will Kill You First. And this is how, just think about it. The amount of heat your body gets off is based on the sweating, and that's limited. And when you sweat, it's not the sweat that cools you, but it's the air that moves across the sweat that then cools you. But as this is happening, your blood vessels are dilating. You're trying to move as much overheated blood to the surface as possible. And you got to find ways to cool off that core temperature, because the more you're working, the more your muscles will work and the faster your temperatures rise. And then your heart starts pumping hard to try and get that blood out to try and cool it down. And you start feeling weak and tired and dizzy if you can't maintain this and you can't get back to that equilibrium. Next. And this is just a breakdown of how it is. Again, your skin is like a big old sensor, and your body is sensing all of this and then triggers a series of events that releases a whole set of messages through the body to cool you down. Next. And our sweat glands. And interesting about sweat glands, I do a little physiology for everyone because we need the doctors, nurses, everybody understanding what is happening to our bodies. And when you think of sweat glands, everybody has about the same amount, whether you're 300 pounds or 100 pounds. And it's in that generation that we will then manage the fluids and manage the production so we can get that cooling. And that's why we lose our sodium, potassium, or electrolytes, and that's why we end up feeling the way we do if we don't get that cooling. Next. And here it is again. Our goal is to get homeostasis. You hear about work-life balance and everything else. Our body needs that management to survive. Next. When we don't get this, our bodies go into a huge response where you see massive amounts of inflammatory responses. You remember back in COVID, we talked about inflammation and how people die because their bodies just kind of overreacted. That's what happens if we don't cool. Till our muscles break down, every part of our bodies fall apart. Next. Keep going, next. So we know who's at risk because your body needs. The very young do not have the reserves, have not quite developed well enough to maintain the homeostasis, and the very old also because of the decline. Next. And when we see this, we see it by our emergency room use, by our urgent care use, we see it over the last decade, 170% increase in the children because of heat-related illnesses. Next. And again, children are different. Here are all the physiologic differences with children. But what's most important in children, it's not the physiologic change, but it's really that the adults must monitor children well because they will adjust physiologically in time. But if the adult is not there to say, stop, come inside, cool, don't put on that extra work, do not send those kids out to play football at the rate they're playing football, we will have more and more loss. So the most important thing is not what happens physiologically to children, but what are the adults doing? Next. Same thing with athletes. When you see the role, how many people are passing and how athletes are so vulnerable. Next. Elderly, that thermoregulation, you see increased risk of heat stroke, heart attacks, strokes, everything. Because to maintain that equilibrium, the heart rate may go too fast, they may not be able to maintain the fluid, and it creates a lot of complications for the elderly. Next. Here's our big summary. You know what happens in our social world where the diseases, heat becomes a threat multiplier. So if you have any underlying health problems, it gets worse. If you can't move as well, you're not going to be able to save yourself from the heat. You tend to live in worse housing, just like my anime. Her housing was poor. She couldn't afford her meds. Her medications made her at risk. And she happened to live in areas that didn't have as much trees, had too much concrete. And those areas are 10 degrees higher than most of the other wealthier communities. Next. So if you look at it, heat, and in Florida where I am, I got to think of the humidity. So the combination of heat and humidity makes you feel hotter at lower temperatures. And so even if you're an outdoor worker, it could be 85, 90 degrees and you feel hotter because of that humidity. That humidity makes that when you're sweating, that air doesn't move across your body to cool the body. So then you end up feeling hotter and the internal temperatures go higher. By the time you get 104 degrees internally, with heat Fahrenheit, you start having that massive degradation, massive decline in your muscles, your brain, everything. Next. In 2019, the data showed that heat was the #1 weather-related killer. And much of our data since across the world, this continues to be the problem. Heat, 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 major fatalities. Next. And we talked about the threat multiplier. 2024 was the hottest year on record. January 2025 is already now listed the hottest year on record. Hottest month that we have in a January. We will continue to see these, and we're anticipating a very hot year. Brazil had 70 degrees centigrade feel-like temperatures just this last week, which is like 130 something Fahrenheit. And this is their summer. So we are anticipating a whole lot more heat this year. Next. Lots of solutions out there. The next slide I see next. I love this slide because it shows just how we have to deal with this problem. Multiple solutions that are going to come from personal and shared. And it's the layering of all these solutions that then will give you the protection. It's not going to be one easy answer. It's not going to be carbon capture. It's not going to be mangroves. It's not going to be trees only. It's going to be multiple solutions. Next. One of these solutions we did was called Project CHOT. This is what Florida Clinicians Climate Action. We developed a system of training volunteers to go out in the community and educate. We also create lots of resources that the persons can continue their own self-directed learning. Next. Our training is a 4 hours training, and we tell them ways to teach this information when they go into communities. Next. That's us in that picture showing how we are in the community doing the work. We go to health centers. We've gone to at least 6 of the federally qualified health centers in Dade County, bringing this information to the doctors, to the patients. Next. The federally qualified health centers themselves, through the National Center, has a Health Center Environmental Health and Climate Change Quick Start Guide. They've done resources throughout the federally qualified health centers, and these are really good ways to get started and understand how you as a health center can effect change. I bring here Virginia B. Andy's Volunteer Community Clinic. It's a free clinic in Southwest in Port Charlotte. They developed a heat response system where they have from the beginning, from the patient enters the waiting room, they have a temperature during the heat season. They check the temperatures, they get the complaints, they have a rapid response, which will take them to cooling center, IV fluids, cooling towels, everything ready, because they take care of a lot of unhoused, low wealth population. So they try and stabilize rapidly. Hopefully, many will not go on to the emergency rooms. They get them in heat exhaustion, and also they will stabilize and get them to the hospital. So this is system. It was not very expensive, and it was a rapid response that was developed in a free clinic in a very high heat vulnerability community. Next. The National Academy of Medicine absolutely recommend They have a lot of resources at this site that gives you many ways to figuring out your carbon footprint, your responses, your educational response, and many, many resources. Next. Lots of tools are out there. It's at this point, we have a lot of information that we can react. And heat, if you look at all these resources, the American Public Health Association, the CDC, prior to what's happened, had a wonderful heat and health tracker where you could track for a whole week. And we were encouraging its use in health centers, in daycare centers. So during heat season, which for us is May through October, the health center, the daycare could see for the whole week what's expected and plan their activities and warn the patients as much as possible. So that CDC heat tracker, I hope it comes back on board, but that is one of the tools that are there. But there's so many tools that we need to start incorporating in how we address climate change, how we address heat, because it is a major impact on health. It's impacted children and adults, and especially the elderly. Next slide. I bring you down to Jorge. This is my real patient. He signed all the consents to be in this picture, and this is where he lived. And I bring this because so often we're bureaucrats, we're doctors, we're doing all this work, and we don't have a good idea of the folks that we talk about who are at high risk and why these changes and rapid intervention is so important because it's impacting our population now. I found his problem with heat because his kidneys kept getting worse. Those oranges you see in the bag that he would be on the streets of Miami selling all those oranges and limes. Very common for many of our undocumented people. Not so common now, but back then it was. He rented that little box, which is a cement block on top of cement. The tree in the back, you could see where the shade, one of it was cut and is dying. And he was hot and his kidneys didn't do well. But Jorge said, rain or shine, cold or heat, he had to work, which is what all of us have to do, especially the low wealth. But he was very optimistic in that sharing his life, sharing his stories, seeing how he lived, and seeing the optimism that he kept in knowing that we would make those changes now to protect him and his next generation. Next. There was a quick run through. Each of these topics take at least 20, 30 minutes just to dissect more, but I hope with this understanding you see that every health center, everyone has a role to play in mobilizing our resources to protect our communities, especially against heat. You can learn more in Florida Clinicians for Climate Action Facebook, or you can follow me at Dr. Cheryl Holder on TikTok or on Instagram. We encourage a lot of these social media connections because our main source, maybe CDC and the federal government, have stepped back from recognizing this, but we can continue this work. Thank you.
Thank you, Cheryl.
Thank you.
Do we have someone coming on to introduce the next panelist?
Yes, I can do that. I was just trying to take a peek in the chat and see if there were any
Oh yeah,
burning
good idea.
questions for Dr. Holder, but
I saw
but-
the Heat Center Preparedness Program.
oh, great.
Health Center Preparedness Program. Each center is going to be responsible. I showed ours that we worked with several of the FQACs in Dade County, Florida Clinicians, where we went into the health center, we brought the literature, we brought cooling towels, and we brought continuing education to all the clinicians there. And we brought lots of resources for the clinicians. So that was one aspect that we could get into communities using that. And the other program that's done by the Southwest Port Charlotte Clinic is another way of having a rapid response that everybody works together. But each center has to really address and look at the risk factors involved. who are the most vulnerable populations that you're going to deal with. Everybody has to deal with elderly because they have multiple medications, multiple social problems. But with the other areas, you then would have to know where your high urban heat areas. Again, our environmental justice website that was taken down had all this data. I do believe some of it is now with Harvard. I'm not sure if the National Association at their site has it, but you could then go to a zip code level and see if you're in a heat urban island or not, and see what your heat vulnerability index is for your communities, and then target your intervention based on that data. That's what we did in Dade County because we had all that data. So we knew exactly Homestead was hot, Hialeah was hot, Liberty City was hot, and we targeted our interventions most of those areas. We then collaborated with different groups. So like the Women's Fund collaborated with us putting bus benches and ads in those neighborhoods that we know are very high heat. So the pregnant woman would know what to do and where to go. And we developed cooling centers using our libraries, the public libraries and parks for cooling centers. So a community-wide approach, especially with the community health centers, you do need to know in the areas you're serving, what are the high-risk areas? And then you can do your response. The electronic health records are improving. Epic is working on, the last I spoke with them, they were working on some questions that could be incorporated. CDC had chilled out 7 questions that could be incorporated in your electronic system that would, part of your social determinants would see, besides having AC, can they pay for the AC? So there are many resources there. Now we just need the time and the dollars, which we were hoping would get in grants, to pull it together, but we can do it as a volunteer and do it through national organizations to still move this forward.
That's great. And we have time for one other question. I see a great one in the chat. In addition to addressing extreme heat, are there other climate-related topics that you do or plan to incorporate? For example, like vector-borne illnesses, et cetera, in the work that you do with health centers?
Right. We do, if you see the one form we give out is that all the health impacts. Now, we target a lot where we are, vector-borne mosquitoes particular. So that's where you have to know where your areas are. And that our CHOT program is Climate and Health Outreach Team. And so we target based on the risk of that area. So heat is big where we are in South Florida. Vector-borne from mosquitoes are big, so we do a lot. Flooding is big, and so we do a lot around flooding and sea level rise. So those are the big areas that we do. Mental health, we also incorporate because mental health, everybody, when it comes to these storms, the stress involved, especially for children. So we incorporate pretty much all that we say at heat wave, but targeting more of the areas that gives you the biggest bang. And it's also your entree. Everybody feels the heat. So the minute you start talking about heat, the easier it is for me to talk about all the other risk factors that they didn't even think about. So that's what we've been doing.
Yeah, no, that's so important. Well, thank you so much for sharing all of your expertise and your insights with us today. We really appreciate you taking time out of your very busy schedule. So thank you. And we'll go ahead and move along to our next speaker, who we are very lucky to have here with us today. We're actually going to be moving into sort of a moderated discussion, so something a little bit different than a formal presentation. But we're so lucky to be joined today by Amy Liebman. Amy has devoted her career to improving the safety and health of disenfranchised populations. She joined Migrant Clinicians Network, which we also call MCN, in 1999, and she currently serves as a Chief Program Officer. With MCN, she has established nationally recognized initiatives to improve the health and safety of agricultural workers and communities. So, Amy, thank you so much for joining us today. We're really lucky to have you.
Thank you so much for having me.
Great. So I think just to kick this off, I would love for you to share a little bit about what drew you to this topic and why heat feels like an important issue for clinicians and others who are working in health.
Okay, so my title is now the Chief Program Officer, but I really have spent my career focusing on worker health and safety. And so looking specifically at the worker population, heat has been a long time as an important risk factor to so many workers, particularly those who worked outside. Dr. Holder introduced us to one of her patients who is really impacted by the heat and the work that he does. So from a worker health and safety perspective, that's really what has drawn me to it. Another piece that I think about a lot that keeps me up at night is that, we saw the chart of the number of high heat days increasing. And so it's becoming an increasingly more dangerous hazard because of the amount of time that we're exposed to it. And we have documented about 1,300 deaths per year in our country from heat, and that's expected to increase dramatically. And then many workers, again, in the documentation, and I can do a whole other talk on that, is really difficult, but many workers die every year from the heat. And the other part, and this is our big takeaway point that I find so interesting about the heat. In this moment in time, getting sick and dying from the heat is 100% preventable. And so that's such an important piece that we want to keep in mind, that we do have the ability to prevent deaths and illness from the heat.
Definitely, yeah, and we can dig into that in just a little bit because I think it is really important to share,
Yeah.
some of those very, very simple but life-saving kinds of measures that are out there. But you kind of touched on something important right there too. You were mentioning one of the workers that Dr. Holder has as a patient. And it made me think about more sort of what are the different kinds of populations, that tend to be really vulnerable to heat illness and heat stress and things like that.
Right. So Dr. Holder mentioned the elderly and mentioned children, and she just talked about what happens in our body and why it's significant. But I do want to underscore that pregnant women are also very vulnerable to the heat, and that heat exposure at any time during their pregnancy can be associated with adverse outcomes, including preterm births, stillbirths, and low birth weight for infants. And so in addition to, heat at any time during pregnancy, heat exposure during the first trimester has also been associated with an increase in the risk of certain kinds of birth defects. So as we're seeing these high heat days, pregnant women are particularly vulnerable to the heat. And also when we think about some of our populations where they have to work, or workers that are outside and they're pregnant and working outside, that becomes an increasing concern. And then,
Yeah.
oh, sorry.
No, go ahead.
The other population, I mentioned it, Dr. Holder mentioned it, but the workers who are working outdoors or in unconditioned spaces. So a lot of times we think about, perhaps farm workers in working in the fields. They are very vulnerable. And also, though, there's folks that are working in restaurants, in the kitchen, as dishwashers, as cooks. Those are often what we call unconditioned spaces. They're not air conditioned. They're not, they're heated, but they're not generally air conditioned. And so the workers' temperature can really increase as they labor during their jobs.
Mm-hmm. That makes me think about too, is there a specific temperature kind of outside that any of us should be worried about? Is it dependent on temperature, or are there kind of all these other factors that can come into play and kind of contribute to heat stress?
That's a great question and a hard one to answer.
Mhm.
So because a lot of it depends on the humidity, how, what the wind is that day. And so, what we call like this wet bulb globe temperature, you're going to hear that as we advance in time around heat. But the bottom line is that there's a number of different factors. When we were looking at the most recently proposed regulations around it, they were suggesting around 80 degrees as a trigger point for certain things, and then anything over 90 degrees as another trigger point. But that's going to be really different if you're working in the shade, for instance, in a desert environment versus working in this direct sun in humidity, so that you really have to think about the different tasks and the different kinds of environments that you're exposed to.
Mm-hmm. And it's sounding really like, awareness is, and sort of being aware of those surroundings is one of the staple things
Right,
that we all
right.
need to know. Amy, if you're thinking about kind of the patients at large out there and what challenges that they all might be experiencing when trying to protect themselves, kind of during those extreme heat events, what are some challenges that that might be relevant to discuss?
Yeah, so there's a lot of challenges, and I think we might want to think about them from sort of this a clinical perspective, as also from the access and accessibility perspective from the patient. So when we think about some of the challenges, one thing, and this is particularly important for providers and for community health workers to be aware of, is that there's a lot of ripple effects going on with the heat. And so one of the challenges is that so many of the patients that we're seeing in our health centers are going to have comorbidities, right? So diabetes, asthma, cardiovascular disease, and all of these patients are going to be at higher risk from the heat. So that's one challenge that we face. Another challenge is that high heat days often coincide with increased air pollution. And that can really affect the health of our patients. And MCN and the National Association of Community Health Centers are doing a whole series on the air that we breathe. So I invite you to join us for those webinars. But the other thing is that it's important to understand is that heat can really also affect actual medications, and it can also affect how a patient responds. So for instance, a patient with mental health conditions that's taking SSRIs, their ability to respond to the heat is going to be really different. An inhaler, for instance, if it's left out in the heat, that can actually weaken that inhaler. So there's all kinds of things to think about with this ripple effect. And the other important thing that patients are going to face, and Dr. Holder really sort of helped weave that into her discussion, is really our access to resources, right? Does this patient have the ability to cool off at night? Is there air, and do they have air conditioning, and can they afford to pay for air conditioning? And the other thing to think about too is that there's really different ways and different roles for each of the providers to understand and respond to some of the patient needs. So when we talk about clinicians and we talk about the patients, we're really, recognizing that community health workers have a really important role to play, and they can be such key players in helping patients access resources and making sure that the providers are aware of what resources the patients do or don't have. And then when the provider sees the patient, there's lots of things that they can think about in helping them assess their risks and come up with an action plan. But another thing that I wanted to stress about some of the challenges that patients might face is that when we have high heat days, we also see, I talked about these comorbidities, but we also see an increase in violence. So, intimate partner violence is really important to think about as a provider, understanding what your patient's risk factors are normally, but also recognizing that violence can increase during heat. And also people with mental health conditions really important to understand what their conditions are, and understanding that heat can exacerbate their situations.
Yeah, wow. I mean, those are things that you don't always think about, you know. So it's I'm really appreciating that you're bringing this to light. A little bit earlier in the conversation too, you referenced that there are that heat stress can be something relatively simple to be able to prevent sometimes. And
Right.
I'm wondering if you might want to talk a bit about preventive measures. Maybe that we can all take, but then also that maybe some of those sort of more vulnerable populations that you mentioned, or
Right.
special populations that you mentioned, should be aware of or could consider.
Right. So I want to be really clear that, heat, the thing that fascinates me is that illness and death from heat is preventable. But at the same time, I've worked for Migrant Clinicians Network for a quarter of a century now. We also know that there are so many other factors that are going to impact one's ability to be able to prevent illness and death from heat. So a couple of things in terms of the prevention. I think the biggest thing to think about in terms of prevention is something that we call acclimatization. And Dr. Holder mentioned this, but I want to underscore this, particularly for working populations who are all of a sudden coming to an area and they were working in heat that wasn't so hot, and now all of a sudden they're really hot. So most of our worker deaths happen in the first week of their work when it comes to heat. So there's this process of acclimatizing and getting used to the heat. And so that is really significant for workers, but also our standing population, but also potentially our unhoused population, because sometimes we're in areas that aren't normally hot, but all of a sudden there's a heat wave and we're extremely hot. And it could have been maybe 60s and 70s one day, and the next day we're in a heat wave. So those first couple of days are really significant. So the acclimatization process becomes a really important factor for us to consider, and seeing if we can help our patients understand that and give them the resources to do that. The other thing that, again, the simplicity of it is water and shade. For workers, it's water, rest, and shade. And those are three things that, again, are fairly simple, are fairly basic. And I, Amy Liebman, sitting here in my living room talking to you, have the ability to sort of have access to all of those when it's hot. And it's important to recognize that although so accessible, it's also can be inaccessible, and particularly for folks who are working, right? We have folks that are going to be scared to lose their jobs. And so even though water, rest, and shade is what's needed, speaking up about having access to those might make workers fearful of losing their jobs. So I think that in terms of the preventative pieces, water, rest, and shade, and acclimatization are really important, but recognizing all of those challenges that workers might face and that others might face in terms of accessing that. And, Dr. Holder mentioned something that I think is also really important. We're experiencing hotter nights. So a lot of times when it's hot during the day and we can cool off at night, that's becoming harder and harder. So air conditioning is really important, and the ability to cool is really important. And another key factor in helping folks prevent heat illness, but accessing and some of the barriers to accessing air conditioning, with just having an air conditioner, A, and B, being able to pay for it.
That's great. No, thank you. Those are really just really important points to be able to consider and think about. And I think before we turn to audience questions, which I think that our participants will have a number of things that this discussion might might provoke in terms of thoughts. Just wanted to ask you for what you feel are some of the main takeaways that you'd like to make sure that participants leave with today when they're thinking about heat and heat illness.
Okay, so I've mentioned this, that heat illness and heat-related deaths is 100% preventable. Acclimatization is going to be key to making sure that fewer workers die, and that water, rest, and shade, regardless of who you are, all of us need to think about that as well. As well as our patients, our unhoused patients are particularly vulnerable, but remembering that water, rest, and shade can really make a big difference in terms of someone's health and their life when it comes to heat.
That's great. Thank you, Amy. So digging right into some questions here, are there some OSHA regulations out there that are helping to protect workers that are working in these extreme heat conditions?
Another great question. Right now, we do not have a federal regulation that protects workers from the heat. But the good news is that there are a lot of states that have regulations. So California, Washington, Oregon, Colorado, New Mexico, Maryland, that's where I'm from. So Maryland just became a state that has heat protections. There's some right now, New Jersey is trying to put forth some heat regulations. So and Minnesota has one as well, but it's for indoor workers only. And Nevada has a regulation as well, but it could use some strengthening. So we have some really good models out there, but unfortunately, we do not have a federal regulation that protects our workers from the heat.
Okay. Thanks, Amy. When it comes to communicating extreme heat safety information to patients, what do you feel is most effective? And then, sorry, I'll ask you the second part of that question. What might get in the way of needed behavior change once patients have this information? So I'm thinking sort of about
that's a
both
great
angles.
question, and I think it's the reality, and I mentioned a couple of those, but so for instance, I'm like saying, oh, you know, water, rest, and shade, right? You're a farm worker or you're a construction worker, and you're like, oh, I'm going to prevent heat illness from water, rest, and shade, and that's a lot easier said than done when you might not have the agency to be able to access those particular resources. So I think it's really critical to help our patients understand what the risks from heat, the you know, really it is killing people, but at the same time really acknowledging some of the challenges. And you know, Dr. Holder mentioned the CDC site, but it is really important to work with your patients to come up with some plans and develop a heat plan, and particularly those that are most vulnerable, and figuring out within what they have access to, how they can help address the heat, and where there are resources that are needed, figuring out ways to link them to community resources. So Dr. Holder mentioned these cooling, like they're using the library to help people cool, or schools to help people cool. But sometimes people might be really scared to go to those places. And recognizing the fears and the realities, and then coming up with a plan that's feasible, and trying the best to work with the patient on where the patient's at, but also making sure that there's a way to try to link them to those resources.
Yeah, thank you, Amy. The next question, and I'm just reading through it. It's a little lengthy, so I might ask you it in bits and pieces here. But how can health centers use patient data to identify the social risk factors? For example, the lack of adequate housing with air conditioning, physical work in health conditions, in hot conditions, physical work in hot conditions, lack of transportation, necessitating walking long distance that may impact their health during the periods of extreme heat.
So another great question. So you're saying, how can we use the electronic medical records, or what do we need? Is that-
Yeah, I think that is what
Okay.
what they're sort of driving at there.
So for someone that comes from this worker health and safety background, like, one of the things that we always talk to clinicians about is really understanding, what does the patient do for work, right? Because that's going to make a big difference in understanding what some of their risks are and challenges are. And I would say the same for sort of the kinds of questions that we want to talk to our patients. And what's interesting about this is that we're not talking about some special medication or some really expensive medication in terms of what it takes to prevent it, but it does take time in terms of really understanding, what are your patient's risk factors, and asking those questions. What is their access to air conditioning? What is their access to being able to pay for that air conditioning? Where do they work? Are they able to take breaks? Are they able to be in the shade? Do they have access to clean water? For our unhoused population, access to water, access to clean water. And so really trying to understand all of these other factors that surround what's your patient's ability to be able to respond to heat. I think that's really important. And so that exposure history is going to be critical, and is going to be a key part of the helping the patient. So it's not this like sexy test that you can administer, or this like amazing medicine that you can prescribe. It's really about talking to your patient and understanding what's happening with that patient.
Great. And then one final question before we wrap up this segment of our webinar today. And it comes from a comment someone made here in the chat that says, our farm workers need to be told that dehydration could cause kidney disease. According to the New England Journal of Medicine, retired workers returning to their countries are showing up at clinics with this disease. And I was curious, just sort of your thoughts of reacting to that, and just letting us know, are there other kind of chronic conditions, diseases, et cetera, that that folks should be aware of?
Right. So great question. A lot of times, when like, in fact, most of this discussion, we've talked a lot about the acute impacts of heat, right? And preventing that heat exposure. But, and Dr. Holder's examples were great, because, one of the things she's like, oh my gosh, the kidneys and this, my patient were not functioning well. So we are really concerned about the impact that heat exposure has on the body. And, we know that heat actually might be one of our first climate-related epidemic. And that epidemic is seen in the form of this, what we call chronic kidney disease. And it's a set of unknown causes, but one of the causes that we know has a place in that is exposure to extreme heat. And so in other countries and certain regions of those countries, we're concerned because young men without other risk factors, that don't have diabetes, that don't have other types of diseases that would make their kidneys malfunction at such a young age, are dying from kidney disease. And so it's not only sort of our older, sort of retired farm workers that might be returning that are experiencing this. It's also, we're very concerned about our younger population. And so the other thing that I love about worker health and safety is that our workers can be our canary in the coal mine, right? So when we're seeing this happen in the worker population, a population that's going to be more exposed because of the nature of their work to heat, we need to be thinking about, what does this look like as we experience more high heat days for our population that might not have access to the ability to cool.
Yeah, well, I mean, thank you for sharing so much, Amy. And I feel that this has been such an illuminating discussion, and really, really happy to have you share both your passion for this topic and all the expertise that you bring. So thank you for that. And we'll go ahead. Yeah.
Thank you so much for having me. I did want to respond to one thing that I said, Becca, before we go, that
Sure.
someone saying about when I said there wasn't a heat standard, and someone mentioned that there is the general duty clause within the Occupational Health and Safety Act that basically, if you have a workplace where the heat is hurting people, it's not a safe workplace. And that is true, but we really do need to really help our employers with very specific heat guidelines, and that's often what a standard does. And we've had much more success in states where there are regulations in saving the lives of workers. So I just wanted to respond to that question. But thanks
Definitely.
so much, Becca, for
Yeah, no, thank you.
chatting with me.
Definitely. And thank you for that deepening of that understanding. And so Renee, I'll go ahead and turn it back over to you and to Matt to share those slides.
Okay, Matt's going to be showing a series of slides here in just a moment. And they have a bunch of different resources from a variety of different organizations. So we have some, we're not going to get into a deep dive of it, but please do take a moment when you have some time to look at some of these resources. You'll be able to click them off of the website once you have it. If you have other questions about them though, do feel free to reach out to us. Here are some very specific clinician resources. Next slide. National Center for Farmworker Health. We've got some from Farmworker Justice. We've got some from us at Migrant Clinicians Network. And then, this session is number 3 of a 4-part series. So we hope that you'll join us again for session 4 in April. That's about workforce and community supports. Please use the link that's in the chat to register for that. And then for those of you who are unable to attend sessions 1 or 2 and you're interested to review those or sharing the videos or other resources with other folks, we invite you to visit our webpage for the series to find all the recordings, transcripts, and slides. And the link is in the chat, and we will include that in the Zoom follow-up as well for all of our registrants to the forum. Next slide. All right, please take a moment to complete the Zoom evaluation to help us improve this activity. NTAPs are proud to offer free training and technical assistance to the public, and this is made possible because of your evaluations of our activities. So when you close out the session, you'll be redirected to the survey. And if you don't have time to do it today, there will be a link sent to you as well. So please, please, please do fill out those evaluations. All right, we appreciate that you participated in our session today and look forward to seeing you at the next session on Wednesday, April 16th.